Hi, everyone. Happy New Year. Welcome to Hope Talks. Thank you for joining today. If this is your first time, or if you have joined us in the past, either way, I want to say thank you so much for tuning in. We're very excited to have you all. We're very excited to have our guest today. And very happy to be starting a new year. This is our first Hope Talk of 2021. So as always, don't forget to leave a comment below so we know that you're here. Let us know where you're joining us from, how you heard about Southside Center of Hope, why you're interested in this topic, any questions that you might have throughout the stream. Leave that all in the comments for me. And we're just going to take a little bit of time here to wait for others to join us. While we do that, please share this live stream. Down in the bottom right-hand corner, I believe, there should be like a little arrow, kind of like a curved arrow. If you click that, you can share this live stream with your followers. Share it directly to your page or any groups that you might be a part of. Share it, via Messenger with anyone you think might be interested. And we would really appreciate that, because the more people we can reach, the more people that have the information we're sharing, and the more people that we can stay connected with as we navigate through this next year. So my name is Catherine Newman. I'm the Development and Communications Coordinator for Southside Center of Hope. And for those of you who are not familiar, Southside Center of Hope is a nonprofit recovery home for women in Chicago. We provide housing and supportive services for single women and women with children who are experiencing homelessness and are in recovery from addiction. Hope Talks, what we're doing here today, is something that we do on the third Monday of every month at 1 p.m. Central Time. We do this live stream. We call it Hope Talks. And the purpose of Hope Talks is to share community resources and have conversations on topics that impact our community. So that's why you will see a wide variety of topics that we cover here on our channel, on our page, through these live streams. And like I said, if you have any ideas of topics that you would like to see discussed on Hope Talks, please leave that in the comments. I do look at those comments. And so today we will be joined by Dr. Sarah Kidder. And Dr. Kidder is a family physician from Friend Family Health Center, which is one of our neighborhood partners, community partners, whatever you would like to call it. Friend Family Health Center has actually been an amazing partner to us throughout the pandemic, and long before that. So we're very thankful for them. We're very thankful to have Dr. Kidder here with us today, and she will be joining us to discuss COVID-19. Because some things are the same as they were, but some things are changing. And I think that this is a good point, after the holidays, for us to kind of reevaluate, remind ourselves what we need to be doing, make sure we're staying safe, make sure we're staying healthy as we come into cold and flu season. So I'm going to bring Dr. Kidder on now. I want to say thank you again for everyone for joining us. And, one more time, if you haven't already, please share our live stream, because I think that the information about COVID-19 is going to be very valuable for anyone, whether they're in Chicago or not. So please share this out and leave us a comment. Let us know where you're joining from, any questions you might have, and any conversation ideas. So here, let's see now here if we can get Dr. Kidder here. Hello, Dr. Kidder, are you there?
Hi, how are you?
Good. Thank you for joining us.
No worries. Thanks for having me.
Of course. Happy New Year. This is our first live stream of the year, so you get to
Exciting.
be our first 2021 guest.
Great. Thank you.
So I was just in my introduction sharing a little about you and a little about Friend Family Health Center, but I'm sure you could give that information much better than I could. So I do want to, before we get started, just allow you to say who you are, what you do, and what makes Friend Family Health so amazing and a great asset to our community.
You all set?
Yes.
Okay. Good afternoon, everyone. My name is Dr. Sarah Kidder. I'm a family medicine physician. I work for Friend Health, which is a federally qualified health center serving underserved patients in the South and West Side. Don't quote me on this. I believe Friend Health has been around for several decades. I've worked for their organization for the past 4.5 years in the Woodlawn office.
Perfect.
I've stayed with Friend Health because I love and respect and have become part of the fabric of their mission, which is providing high quality primary care to residents on the South Side.
Great. Yeah. And we've been partnered with Friend Health for quite some time. And, I was mentioning in my little introduction that Friend Health has been such an amazing partner for us. The women that we serve here are underserved, specifically medically, for quite some time before we begin providing services for them. And Friend Health has, there's been no hesitation. Any of our residents that need any kind of care, they can find it at Friend Health. And, even as the pandemic has changed the way that people are receiving and providing healthcare, I really feel like you all have not missed a beat. So we are so thankful to have you as a partner.
Thank you.
So I want to talk about COVID-19. I know some things are the same, but some things are changing. And I think this is just a good time, a new year, the holidays are over. It's a great point for us to be checking in and reevaluating our practices. So I guess the first thing that I want to talk about, is actually the risk that still remains. We know anyone can get COVID-19, but I'm curious your perspective on, who might be the most at risk. And then, also kind of let's just start with who's the most at risk, and then we'll get into minimizing risk later.
Sure. So in terms of decreasing your risk, nothing much has changed in terms of social distancing, wearing masks, small group gatherings outdoors. Nothing has changed there. The risk within our community is still high. So if you are going outside of your residence, wear your mask, bring your hand sanitizer, wash your hands when you get home, and really try and avoid any unnecessary gatherings outside of the home. There are, as we are learning more and more, and this information does change quite frequently, there are some folks who are going to be at higher risk for developing severe illness from COVID-19. And severe illness means you're at higher risk of being hospitalized, higher risk of being admitted to an intensive care unit, higher risk of being intubated or needing a breathing machine, and higher risk of dying. So we know at this point, patients with certain medical conditions such as diabetes, type 2 diabetes, COPD, heart disease, obesity, smokers, those patients are at higher risk of having severe illness. And we think that there are other people who may be at high risk, such as patients who have autoimmune disorders or are immune compromised, type 1 diabetics, cancer patients. So that information is changing as we learn more and more about this virus. And it's good to kind of stay up to date to know if you are at higher risk, because it may change your behavior and help you make a more informed decision about the risks that you should and should not be taking right now.
And I do want to clarify with you something that's been frustrating for me navigating through this pandemic is, hearing from some of my friends and family members that are in good health, maybe are of a younger age, and get into this mindset that because they're not high risk, that there's no risk for them. So I just wanted to quickly touch on with you, just because you're a healthy person doesn't mean that you are, free of having those severe consequences of the virus, right? I mean, we're seeing people all the time that are blowing our minds that they got that sick and died, right?
That's absolutely correct. So, just because you don't have any of those high risk conditions does not mean that you may not become seriously ill or die from COVID 19. So, my best recommendation is no matter what your health history, stick with those public health guidelines to decrease your own risk of exposure, as well as keeping your community safe, right? Because if
Mm.
you get COVID 19 and you spread it to someone, that person may be in grave danger as well. So there's the personal risk mitigation, but also the community health aspect that's important for everyone to consider, no matter what your health history is.
Perfect. Yeah, thank you so much for clarifying that, because I feel like I've been on a bit of a crusade with certain people in my life. But I know it's just a very tough time, and we want to get back to normal, but you have to think about the health and safety of the other people around you. Um, so
It's
I do,
also very unpredictable too,
yeah.
in terms of who out of our healthy population is going to become sick or die. There's really no way of predicting that. So again, I think it's best to err on the side of caution to keep yourself safe and others safe.
And so I do want to talk about what I'm most interested and excited to talk about today is the vaccine. I think a lot of people have had kind of drilled into their brains everything that we just touched on, whether they have heard it, absorbed it, and applied it or not. We know that it's out there, and but I think there's a lot of more questions about the vaccine now that it's kind of been released and started to be administered. So I wanted to ask you, if you're in support of the vaccine, are you encouraging your patients who are eligible to go ahead and receive it? And if so, why?
And I'm really excited for this conversation too. I think that this is a really big topic and we take it step by step, that we have an opportunity to really educate and help people feel more confident in their decision about the vaccine. So, starting with your first question, without hesitation, yes, I am going to be recommending the COVID 19 vaccine. This is a vaccine that could save someone's life.
Mhm.
Um, if we just briefly kind of reflect on the statistics, United States is about to hit 400,000 deaths within a year. Illinois is at over 18,000 deaths. And if we kind of break that down, on a daily average, that was 50 people per day over the last year. It's a tremendously dangerous virus. And I know we're going to hop into more detail about the vaccine, but we now have a safe and effective way to protect ourselves. So yes, I will be recommending it for my patients.
And have you yourself received the vaccine yet?
I am grateful, incredibly grateful, that on January 5th, I received the first dose of Moderna. I went through Loyola University, who was offering it to healthcare providers, and I'll be getting the second dose on the 31st.
Good, that's amazing. And I do want to ask, well, we're going to get into side effects a little bit later.
Sure.
So I'll ask you, if you experience any side effects once we get to that point. Because I want to talk kind of a little bit more details about the vaccine before we move on. Because I want to see if you could just give us a good understanding of how vaccines work. I think there's a lot of misinformation around there, even, with the flu vaccine that we're used to getting. So can you just, from a medical perspective, what really is a vaccine?
Sure. So a vaccine is a way for us to essentially train your body's immune system to recognize a germ and be able to fight it off if you get exposed to it so that you don't get sick. Vaccines work in different ways, and I'm sure we'll go into how the COVID vaccine works. But in general, that is the job of the vaccine, to create protection in case you get exposed to a germ that could be potentially life-threatening.
And so I know that there are two different versions of the COVID-19 vaccine. There's the Moderna and the Pfizer. One, I believe, is 1 dose. Moderna is 2 doses. I could be wrong about that. You can let me know, but
So far, Pfizer and Moderna are both 2 doses.
2 doses.
The Johnson & Johnson, which has not been approved yet, but looks like it may be approved in the next couple of weeks, is going to be a 1-dose option.
And what is the need of having the 2 doses?
The reason we need 2 doses is because that was the amount of training, for lack of a better word, that your body needed to develop a full and robust response. So after 1 dose, we found that people who got the vaccine were only about 50% protected, meaning 50% of the time, if they got exposed to COVID, they got sick from it. After the second dose, that brought the effectiveness all the way up to about 95%. I mean, 95% of the time, if you got exposed to COVID, you weren't going to get sick. So it's really just the dose that was needed to create that your body's immune response. Whether or not we will need a booster dose at some point, like we need for our flu shots and we need for our tetanus boosters, we don't know that yet, but we'll learn more as the months roll on.
Mm-hmm. And so you said with the 2 doses, it had increased the effectiveness to about 95%. So does that mean, 5% of the time the vaccine doesn't, or 5% of the people the vaccine doesn't work for them? Why can we not get it to be 100% effective?
It would be wonderful if we could get it 100%. But right now, that's just not how vaccines work, or our ability to create vaccines. It's just not how they work. 95% is an excellent effectiveness. And you are correct that about 5% of people are still at risk of getting sick from COVID, but with the immunization, you are much less likely to become severely sick or die, because your body already has that immune protection. So it still provides you some protection, even if you do become ill. You're much more likely to have a mild illness.
And so I do want to talk about side effects a little bit, because, I mean, I'll be honest, I do not receive a flu shot. I hear a lot of stories of people believing that they get the flu from the flu shot. I don't personally believe that. It's just not something that my family did growing up. I never adopted the tradition as an adult. Now that I've lived through a pandemic, I think I might change my mind about that. But up until now, I got my normal vaccines as a child, was not getting flu shots throughout my life, have stayed pretty healthy otherwise. But now thinking about the COVID-19 vaccine, there's really no question in my mind of, whether or not I'll get it. Of course, I'll get it when I'm able to. But what do you have to say to people who think that the COVID-19 vaccine is going to give them COVID-19?
it's a very common misunderstanding of how vaccines work. Um, and it's very similar to the hesitancy I see with the flu shot,
Mhm.
a fear that, you're going to give me the flu. Well, just like the flu shot, the COVID vaccine is not a live vaccine, meaning we are not giving you COVID-19. That would be very dangerous. You would get sick if we did that. However, we are giving you something that's going to produce an immune response, and you may get some symptoms from that, including, fevers, body aches, sore arm, headache, fatigue. Those are common side effects. Patients hate them, hate them, hate them. Uh, Doctors love them, love them, love them, because we know this is your body's immune system building protection and keeping you safe. That these side effects are transient. They're probably going to last about 24 hours and then they're going to be gone. And they are vastly better than becoming sick or dying from something that is vaccine preventable.
And so, if you don't mind my asking, I'm curious, what symptoms did you experience after you received your vaccine, your first?
Absolutely. Yep. In the spirit of full candor, the COVID vaccine for me was much more sore than a flu vaccine. I tend to get about a sore arm for a day or two with the flu shot. I was pretty sore for about 3 or 4 days, the site of injection. And about a week later, the area was a little itchy, but nothing I needed Benadryl or medication for. I will say that many of my colleagues after the second dose had more of the flu-like symptoms that lasted about a day, the headache, low-grade fever, fatigue.
Mhm.
And I'd be happy to share with your facility my experience with round two.
Yeah, please. Yeah.
Absolutely.
Would love to hear from you, for round two.
Hmm.
Um, so thank you for sharing that personal element. I do really appreciate
Absolutely.
being open about that. Because I think that that is really a big key, not necessarily just for COVID, but I think in healthcare across the board, a lot of people don't want to talk about what they're going through
Hmm.
with their friends, their family, or even their doctors. They downplay a lot. And I think if we were all just a little bit more honest with each other, we might find that it helps everyone. So again, thank you. Um, and, it sounds like, your symptoms were pretty mild. What we can expect are fairly mild. Are there any, kind of one-off severe reactions to the COVID vaccine that are being reported? Anything that we should really be mindful of, or, people that maybe have like pre-existing conditions that might, be adversely affected by the COVID vaccine? Anything like that that we might need to be wary for?
That's a great question. So far, there are no chronic medical conditions that would contraindicate the vaccine. So, stroke, hypertension, diabetes, asthma, autoimmune, none of those prevent you from getting the vaccine. Okay. Um, if you are a patient who has a history of anaphylaxis, which is a severe allergic reaction, you should let your doctor or whoever is giving you the vaccine or offering you the vaccine know about that. They're going to monitor you for 30 minutes instead of 15 minutes. And there have been a few cases of anaphylaxis or severe allergic reactions in patients who have received the vaccine. Um, all of them were treated successfully.
Mhm.
And for those patients who have had a severe reaction to the COVID vaccine, those patients should not get the second dose. But right now, that's the only contraindication or only group of people who should not be getting the COVID vaccine. Otherwise, adults 18 years and up.
Perfect.
Yeah.
Um, well, okay. Do you think it's only, I have a personal question because I have a severe food allergy and I do experience anaphylaxis.
Mhm.
Would that would that be something I should mention, or is it only if you have, like a medically like a medication allergy to a medication that you should be?
So if I could share, my youngest son also has severe food allergies and has had anaphylaxis multiple times.
Mhm.
So my plan, when it becomes available to children, will be to get him vaccinated with his allergist or in a medical office that can handle allergic reactions. So, to respond to the personal question, no, your food allergies do not mean that you should not get the vaccine, but you should make someone aware when you do decide to get it. You should make them aware that you have a history of anaphylaxis.
Okay, perfect. And so the other question I have related to the vaccine, or I guess kind of with like the timeline of immunity, is that there's been a lot of, information. I have found that it has been regularly changing, but across the board, it kind of seems, to be steady that if you've had COVID, you're safe from getting it again for a certain period of time. That period of time I have seen change in a lot of readings I have done, but it does give you, some immunity from it for some period of time. Um, I mean, how is that? I guess not how is it different from the vaccine, but if you've already had COVID, are you safer from it than if you would get the vaccine? Or if you've already had COVID, should you not worry about getting the vaccine? How does that work out?
And you're right that this is an area where we are learning new information every day. So the information I can share today may be different 3 months from now.
Yeah.
But our current understanding is that most people who have COVID-19, the illness, develop antibodies that are going to last about 3 months or 90 days. So if you've had COVID, but you want to get the vaccine, the current recommendation is that you could wait about 90 days before getting the first dose of the vaccine. The problem is that we don't know who's going to have antibodies for 90 days, who's going to have it for 12 months, who's going to have it for 6 months. We don't know, and it would be quite burdensome to be drawing everyone's antibodies to say, okay, now you don't have antibodies, so go ahead and get your shot. So currently, you should have antibodies for about 90 days. Thereafter, we're not sure. You
Yeah.
should go ahead and get the vaccine.
Mhm. So that's kind of, the bulk of the detailed questions I wanted to ask you about the vaccine. I did want to give you an opportunity, since you're a medical professional and I'm not, if you think maybe there's something in there that I missed that is important information to share, please do so. If not, I can go ahead and move on.
What's our timeline? Because I had a couple
Yeah,
key
we have
points I wanted to
about
touch
30
on.
more minutes to talk.
Okay,
I have some other stuff I want to ask you kind of, about the community, but if you want to
sure.
talk a little bit more about the vaccine, please do.
I wanted to kind of briefly touch base on what is in the vaccine so
Mhm.
people know what's in it. And I wanted to talk about the timeline of how quickly this vaccine was produced. Do you think we have a few minutes to go over
Yes.
that?
Yes.
Okay. Let's start with what's in this vaccine, because for me, when I started hearing there's a new vaccine coming out, I'm very risk averse. I'm not big on new stuff. And
Mhm.
that was one of my biggest questions. What's going to be in this thing? It's actually, I bow down to the scientists who created it, because, I'm sure it was very challenging to create. But when you look at the ingredients, it's a beautifully clean and simple vaccine. And I call it a COVID donut. So they use mRNA, which is genetic material that codes for the spike protein. If you've seen that red ball picture of your COVID with all the little spikes on it, the spikes is how your body recognizes COVID as a germ and builds antibodies to protect you from it. So the mRNA codes for the spike protein to train your body. That mRNA is wrapped in salt, sugar, and fat. There's your donut.
Donut.
That's it. That's it. So it's a beautifully simple vaccine. I was very excited to see that it didn't have like a list of 27 ingredients I couldn't pronounce. It's like, okay, salt, sugar, fat. Okay, that's
Yeah, I put that in my body pretty much every day anyways, so
um,
might as well do it in a way that'll keep me
yes.
safe.
Especially as a mom with a child with multiple allergies, that
Yeah.
was important to me.
Mhm.
So it's a pretty clean vaccine. The second, I definitely wanted to touch base on the speed at which this vaccine was developed, so that your clients have a very good understanding of how did we get a vaccine in 9 months versus 4 years, which is kind of the traditional rollout.
Mhm.
Just briefly, we had a tremendous amount of information and research already available from the SARS and MERS epidemics. SARS and MERS are both coronaviruses. They're almost 80% identical to COVID-19. So we had actually developed a SARS vaccine. We were in the trials to develop that, that recognized the spike protein. However, SARS kind of burned itself out. So that trial wasn't finished because we didn't need the vaccine anymore, but we had all this beautiful data already in place. And then because of the pandemic emergency, researchers were allowed to do the various steps of the trial all at the same time instead of one after another. So they were able to look at safety, right? The first step, that's phase one, small group of people to make sure this thing wasn't toxic.
Mhm.
They were allowed to look at the dose and the effectiveness. It's a larger group of people. And finally, here's the key point. Phase three of this trial, which had over 30,000 people in it, where half of the participants get a COVID vaccine, half get a placebo or nothing. We see who gets COVID to see if this works. That's the gold standard of scientific research. No steps were skipped there. The FDA required a full set of data from phase three. But because we were running these things all at the same time, after about 3 months, they had their data.
Mhm.
Remember, to do scientific research, you need volunteers. And we need people, unfortunately, to get exposed to COVID. Well, that happened quickly because we're in a pandemic, and volunteers poured into these studies.
Yeah.
In addition, the funding was just tremendous. So they gave companies money to start building manufacturing plants. So if these things got approved, we were ready to crank them out. So I think that there is a difference between speed and rushed. This vaccine was developed in a speedy fashion, but it was not rushed.
Mhm.
So you still had to prove safety and effectiveness. And I think that's going to be a big hesitation for people, but I want them to understand that the FDA's job is to keep people safe and to not release medications or vaccines or medical devices that are not safe and not effective.
Yeah.
And they certainly wouldn't roll out a vaccine if those two criteria were not met.
So I think that's very good to know. And I like that you made that distinction that this was done quickly, but it wasn't rushed. Because there is a big difference there. And so I mean, do you feel like very hopeful about this? Do you feel like this is kind of, there's an end in sight? I mean, I know it's a little far off still, but is this, from your perspective, gonna really, help us get back to, I don't want to say get back, but, move forward into, a more open way of living, a more freedom and kind of back to our old ways and things that we enjoy and
I have to hold on to hope. And I know things will get better, right? I
Yeah,
know they will.
they have to.
What I wonder about, though, and I'm not an epidemiologist, I'm not an infectious disease specialist, but I wonder if COVID-19 may become endemic, meaning like the flu, it kind of shows up. It's in the population, but it's not at this pandemic level
Mhm.
where we're all so very isolated. I absolutely have hope that the vaccines, candidly, the change in administration, and that a push for a more unified approach to this,
Mhm.
we have hope. We have
Yeah,
hope. We got to hold on to that.
I agree.
I'm done with masks. I'm done. So
I know, it's so funny. I've been, rewatching some old TV shows and, uh, I find myself wondering why no one in the show is wearing a mask. I've just
Like,
become
there's more
so
than 10
used to
people.
it.
Yeah.
I'm like, she didn't even put her mask on. The grocery. So that's how I know. I mean, it's that's why I hate to say go back to normal, because we have found a new normal.
Right. I hope our new normal is less restrictive.
Yes.
And
Yeah.
I'm hopeful that it will be.
So I want to talk a little bit with you, just kind of about the effects, the broad effects of the pandemic on our communities. There's been, I mean, things are happening so quickly. It's hard to get really, really accurate numbers. A lot of data doesn't come out until, a year later, 6, 8, 9 months after the fact. But we can see that predominantly Black and Brown communities have been adversely affected by the pandemic. I think it's hard to say, exactly why. That's something we probably won't learn until, much later. But, the numbers are there, the hospitalization rates are there, the infection rates are there, and we can see that these communities are struggling. And also, these communities are the core service areas of Front Health. So
Mhm.
I'm just really excited and interested to hear your perspective. As a doctor working at a community-based health clinic, um, what have you seen? Do you believe that that's true, that Black and Brown communities are being most impacted by the pandemic? Do you have any thoughts or ideas on why that might be?
Sure. Yeah, kind of in preparation for this, just kind of looking at numbers and statistics. Roughly, our Black and Brown patients are about 4 times more likely to be hospitalized and about 3 times more likely to die. So the COVID-19 pandemic has absolutely had a disproportionate effect on the Black and Brown community. And it has everything to do with kind of institutional disparities. Everything from disparities in access to high quality medical care, to healthy food, to housing, to disparities in jobs, whether or not you are a frontline worker, whether or not you're able to work from home. All of these pre-existing disparities in the Black and Brown community has led to a disproportionate impact on it because of the pandemic. So it's, there's absolutely not one single factor, but there are multiple factors contributing to that disparity.
And so, I think that they're also, and you might have mentioned this, but I want to come back around to it. I think not only with regard to COVID-19, but I think in healthcare across the board, there is some hesitation for underserved populations, and not even necessarily underserved populations. I think, and for people of color across the board, no matter their economic status, there's some hesitation to be trusting
Mhm.
within healthcare. How do you, build trust with your patients? And has that been, any more difficult to do now that you're operating, via telehealth in a lot of situations? I'm just interested, kind of how do you combat that? And how have things changed since COVID has hit?
Sure. No, I think candidly, as a white doctor, that's an earned trust. Um, that's listening first and foremost, just shutting my mouth and listening
Mhm.
to what my patients have to say and what they need and what the communities need. It is a willingness to be open and honest and candid, and to be willing to admit to disparities and past negative experiences, and then forging a path forward. Knowing that there has been tremendous harm done in the past, and trust lost. How do we gain it back? I think it starts with dialogues like this, right?
Yeah.
It's in the context of COVID. It's going to get a COVID shot. I wouldn't recommend a COVID shot to my patients if I'm like, oh no, I'm not.
Right.
No,
You're
not
not
getting
gonna
that.
get it yourself. Yeah.
And it's being able to be honest with things like that. It's providing our Black and Brown community with access to evidence-based facts so that they feel more confident making a decision that may be right for them.
Yeah.
It takes time and it takes work. And again, I think that's an earned privilege.
Absolutely. Yeah. Yeah. And I think you're right. We can't ask people to do things, tell people to do things that we're not willing to do ourselves. So I think that, us having this conversation is really important, but also us getting our COVID vaccines is really important.
Yeah.
So something else that I want to talk about, I guess is just kind of, we talked about the, basically, the CDC recommendations of distancing, masking, hand washing to protect us from this. But, there also is a lot of information swirling around of, I guess, maybe immunity boosting tactics. I've seen a lot of people recommending that we all take vitamin D every single day. Just different things like that. I mean, there's always like those holistic little tips and tricks, immunity boosting tricks that people talk about. But I'm curious to see, as a medical professional, is there actually anything that you would recommend that you think could be effective in helping us strengthen our bodies and protect ourselves in that way?
It's a great question, and we will cycle back to kind of holistic at the end. I think if you're a patient who has any chronic medical condition, diabetes, blood pressure, asthma, your first line of defense in terms of keeping your body healthy and at less risk of having severe disease from COVID or severe illness from COVID is getting that health condition under good control, right? So working with your doctor to get your asthma under awesome control, getting that blood pressure down under great control, getting your sugars down. Because if you do then get exposed to COVID, you are less likely to become very sick. If you're a smoker, work on it. This is the year, cut back. This is a good year to quit. That's one of the highest risk categories for severe illness from COVID. Making sure you're drinking plenty of water. And then holistically, there's really not good evidence-based research for things like vitamin D, vitamin C, but it's not going to hurt. It's not going to hurt. No one gets enough vitamin D in Chicago anyways. Well, good for your health. It's not going to hurt. It's okay to take a vitamin D supplement. Vitamin C, good for immunity. Would it prevent you from getting COVID-19? Unlikely. Might it perhaps kind of boost up your immune system? Maybe. And is it going to hurt? No. So, I think natural supplements are reasonable. I wouldn't go out and spend $1 bajillion on supplements to prevent COVID. I would mask and socially distance for now. Yep.
So, it seemed like over the summer we had, a small break. Maybe COVID didn't go away, but we had reached a point where we had flattened our curve, our infection rates had dropped, our hospitalization rates had dropped, restrictions were lightened to a certain extent. And now we're kind of back to where we were, I think. You might know a little bit better than I do, like exactly what those numbers were in March and April compared to what they are right now. But I think as a private citizen, it feels like we're right back to where we started.
Yeah.
And so I'm just kind of curious, why is that? Why did that happen? Were the infection rates lower over the summer just because we were all able to be outside and now we can only be inside? And then, you look at places like LA where it's always warm, but their infection rates are off the chart. So, what really helps and what hurts, and how did we get back to the beginning?
Yeah, I think two factors are likely. One, just like you said, in the summer, we were able to be outside. And in those instances where people got together, it was much easier to stay socially distanced. It's very clear that your risk of contracting COVID is higher indoors. That's been clear since the beginning of the pandemic. And I think the other factor is that we had pandemic fatigue, and we had the holidays and cold weather, and we let our guard down, and we gathered. We gathered with people outside of our households, and the numbers, they went through the roof. So, as tough it is as it is, we know social distancing works to bring the numbers down, and it's awful. I have not seen my parents since 2019.
Yeah.
And I have not seen my brother and sister since 2019, but it's the right thing to do. Not just for them, but for anyone else I might come in contact with. When we see kind of hot spots in places like LA, California had been doing great. They did loosen the restrictions. We saw a return to things like indoor dining, indoor bars, and again, they probably experienced some fatigue as well. There may be other factors as well. And being not an epidemiologist, I'm not an expert, but those two factors probably played a huge role in the spike that we saw.
Yeah. And they do have a much more concentrated population than we do here. So I'm sure it's more difficult
to socially distance.
Right.
Yeah.
But do you think, even with the vaccine, are we ever going to stop wearing masks? I don't know. If you have the vaccine, do you stop wearing your mask?
Not yet. So not yet. Two thoughts on that. First, if you do get your vaccine, you still need to wear a mask and socially distance. Right now, our understanding right now is that the vaccine is going to protect you 95% of that time from getting ill from COVID. What we don't know for sure yet is, are you still able to transmit the virus? So if you get exposed and you have an asymptomatic or an incredibly mild case, can you still transmit it? That has to do with the way the vaccine works and the types of antibodies that your body may produce. Neutralizing antibodies would help prevent that transmission, meaning if you got exposed to COVID, you're not going to get it at all. You're not going to give it to the next person. We don't know yet if the vaccine is going to do that for us. So even if you get your vaccine right now, still stay masked. Might we see a day where we don't have to mask? I hope so. We do need enough uptake of the vaccine. We need about 80% of our population to receive the vaccine to achieve what's considered herd immunity, where it's very unlikely to get any spread among people who are not vaccinated because so many people are vaccinated. That's going to take time. And again, I'm keeping my fingers crossed that we see the process of getting people immunized just kind of explode and hurry up over the next couple of months.
So do you know who is eligible to receive a vaccine right now?
That's a good question. I would check the Illinois Department of Public Health website for the most recent up-to-date information. We may be into phase 1B, where 65 plus or 75 plus may be eligible for the vaccine. I know that some hospital systems are starting to open up to patients, so stay tuned. I mean, this is, if you are someone who wants the vaccine, I would encourage people to get on that internet, be looking at public health departments, be looking at hospital systems to see who is offering the vaccine and be very proactive, because that's how you're going to find out when it's available.
And so the last thing that I wanted to discuss with you was just the resources that Friend Health provides during this time. I know that there is some COVID testing there,
Yes.
but I just wanted to give you, an open opportunity to share just, how Friend Health is supporting its patients and the community during the COVID-19 pandemic.
So a couple different fronts. We offer COVID-19 testing at 2 locations 5 days a week. Meaning if you have symptoms and you're not sure if they're COVID symptoms or you've had an exposure, you should get tested. And Friend Health, if you go on the Friend Health website, the information is there on how to get yourself an appointment. For patients who have COVID or have had COVID-19 and maybe recovering from it or coming out of a hospital visit, we're providing care for those patients. And I think very importantly, Friend Health is continuing to provide primary care and chronic disease management for patients, which I think is critical because it's real easy right now to just wall yourself off from the world and live under a rock right now. The thought of coming into a doctor's office for many patients is very scary and intimidating because no one wants COVID, right? No one wants to be exposed to it, but it's absolutely critical that we keep getting regular health care. We're staying up with mammograms, we're getting our PAPs, we're checking our blood pressure, we're getting our labs drawn. That is still so very important. So a combination of in-person care and telehealth to try and keep our patients as safe as possible, but also be moving care forward.
And so for the COVID-19 testing, can you tell me just that's kind of the last thing I wanted to talk to you about, just, how it operates? Is it a drive-through? Do you need an appointment? Do you walk up? Kind of how does that work?
We encourage appointments, although I do think that at many of the locations, a walk-up or a drive-through would be possible. Some of our sites are walk-through, and some of them are drive-through. Again, on the Friend Health website, every day it'll give you instructions on how you would get an appointment, what locations, because we try and hit a couple different locations to have access for our communities, our local communities. It's pretty straightforward though.
And do you offer I had an experience where I had been exposed to COVID and I was, unsure because of the timeline and because of, the circumstances in which I was exposed to this person who had tested positive. I just wasn't sure, I guess, when I should get tested, if I should wait a couple days, if I should go right away. I had tried to call the CDC and they provided plenty of information, but it wasn't necessarily relevant to the circumstance that I was describing. It was very standardized. So I'm curious if Friend Health has any kind of like a call a nurse or a COVID hotline or something like that, where you could, kind of see if you should get tested before you come.
Yep. So we have a team that's, our kind of our COVID task force or our COVID team who field questions and phone calls from patients every day. And we'll kind of walk you through the steps of what you should do if you're symptomatic or what you should do if you think you've been exposed.
And that's on the website as well, I'm assuming, right? The phone number? Okay, perfect. So we'll definitely have to put the The website link in the comments. I'll do that as soon as we're done here. And that really is the extent of the questions that I have for you today. Is there anything, if there's anything else that you would like to share, you're welcome to. If not, we can say our goodbyes.
Just an open invitation if any of the ladies have questions or concerns, an absolute open invitation to shoot me an email. I think my role is to share information, right, for people to be able to make a decision about their health. So feel free to reach out.
Perfect. Well, thank you so much for joining us today, Dr. Kidder. I know it's been
Thank you.
very informative for me, so I'm sure everyone is very thankful for the information that you gave us today.
Well, thank you so much for having me. It's a pleasure.
Perfect. Well, Happy New Year, and we'll talk again soon.
Take care.
Great. Bye. Okay, so thank you for joining us today. I hope that you all found this conversation to be informative and impactful in some way. I know I definitely did. I had a lot of my questions about the vaccine answered. And I'm so thankful that Dr. Kidder was able to join us. As I've said 100 times, I'm also so thankful for our partnership with Friend Health. So, the last thing I really want to say is just to remind you all to share this video. I think this information is going to be very helpful for everyone across the city, across the country. I think a lot of people have a lot of questions, and we just got a lot of answers. So make sure you like us on Facebook, Twitter, LinkedIn, YouTube, follow our pages, subscribe, turn on the notifications so you will be informed when we are going live. If there's a topic that you would like for us to cover, leave it in the comments. I will be looking at those shortly. I will add the Friend Family Health website to the comments if it hasn't been added already. To learn more about Southside Center of Hope, you can always visit our website, www.southsidecenterofhope.org. And you can always reach out to us via social media, and I will be happy to answer any questions you have. And so, that is all I've got for you today. Thank you again so much for tuning in, liking, commenting, following. I really appreciate it. And I will see you all next month on the third Monday at 1 p.m. Central Time for our next episode of Hope Talk.